Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Tuberculosis. Introduction. Tuberculosis, also known as TB, is a bacterial infection and a leading cause of death worldwide. When tuberculosis becomes active, it kills 60% of those who are not treated. This amounts to millions of deaths worldwide every year. This program explains latent and active tuberculosis infections. The program discusses the diagnosis, treatment, and prevention of tuberculosis. Causes. Tuberculosis is an infection caused by a bacterium called Mycobacterium tuberculosis. The bacterium is also called tubercle bacillus. Tuberculosis spreads from person to person through the air as a person with active tuberculosis coughs, sneezes, speaks, or breathes out. The bacilli are in microscopic droplets expelled from the lungs. This is called the initial infection. After a person becomes infected, the tuberculosis bacteria are controlled by the person's immune system. The infection becomes latent or confined. When the bacteria spread out of control, the infection becomes active. Since most infected people breathe out only a few bacilli when they exhale, tuberculosis usually only spreads after 1 or more months of exposure to someone with active tuberculosis. Good ventilation is the most important measure to prevent the spread of tuberculosis. Tuberculosis is not usually spread through personal items belonging to those with tuberculosis, such as clothing, bedding, or other items they have touched. Latent versus active infection. As a person breathes infected air, the bacilli go to the lungs through the bronchioles. At the end of the bronchioles are alveoli. Alveoli are balloon-like sacs where the blood takes oxygen from inhaled air and releases carbon dioxide into the air exhaled. Tuberculosis bacilli infect the alveoli. The body's immune system fights them. The immune system includes special blood cells that identify and destroy foreign material, including viruses and bacteria. These blood cells are called white blood cells. Special white blood cells, called macrophages, attack tuberculosis bacteria. Many of the bacteria die. Tuberculosis bacteria have a cell wall made of a complex waxy material. This wall protects some bacteria inside the macrophage. Other immune system cells surround the macrophages and form a group of cells. This is called a tubercle. If an infected person is not healthy, particularly if he or she has a weak immune system, the bacilli may overwhelm the immune system. They then break out of the tubercles in the alveoli and spread to the lungs and other sites of the body through the bloodstream. This is called active tuberculosis. If an infected person is healthy, the immune system controls the initial tuberculosis infection. The tuberculosis bacilli may remain confined within the tubercles for years. This is called latent tuberculosis. Latent means dormant or sleeping. About 90% of infected people heal completely after the initial infection. The tubercles harden and the bacteria cannot break out again. For about 10% of infected people, the bacilli inside the tubercles become active sometime later in life when their immune system becomes weak. If the body's resistance is low due to aging, infections, malnutrition, or other diseases, the bacilli may break out of the tubercles and cause active tuberculosis.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Only people with active TB are contagious. Active tuberculosis spreads from alveoli through the bloodstream or lymphatic system. It may invade other areas in the body, such as the bones, kidneys, skin, reproductive system, urinary system. At the new sites, the body's immune system kills many bacilli, but immune cells and local tissue also die. The dead cells form masses called granulomas, where bacilli can survive but not grow. The early symptoms of active tuberculosis include weight loss, fever, loss of appetite, night sweats. Some patients may have little or no symptoms with TB. As more lung tissue is destroyed and granulomas expand, cavities develop in the lungs and sometimes expand into larger lung airways. This allows large numbers of bacilli to spread when the patient coughs. As granulomas grow and destroy lung tissue, they may cause more coughing and shortness of breath. Granulomas can also eat away at blood vessels, causing bleeding in the lungs, which could result in bloody sputum. Sputum is mucus coughed up from the lungs. Symptoms of tuberculosis involving areas other than the lungs vary depending on the organ affected. For example, when tuberculosis infects the spine, it can cause severe back pain or back deformities. Diagnosis. Latent tuberculosis or initial infection can be diagnosed with a skin test called a Mantoux test. This test can identify most people infected with tubercle bacilli 6 to 8 weeks after initial exposure. A substance called PPD is injected under the skin of the forearm and examined 48 to 72 hours later. If a red welt forms around the injection site, the person may be infected with M. tuberculosis, but the disease is not necessarily active. A blood test known as quantiferin TB can also show if a patient has been exposed or is infected with M. tuberculosis. To diagnose active tuberculosis, a healthcare provider relies on symptoms, the patient's history of exposure to TB, and X-rays that may show evidence of TB infection, usually in the form of cavities or lesions in the lungs. The healthcare provider will also take sputum and other samples to be examined by a pathologist. It is important to determine the type of tuberculosis bacteria involved in order to prescribe the most effective medication. Treatment. If not treated, active tuberculosis can be fatal, killing up to 60% of patients. When treated, 90% of patients are cured. Successful treatment of tuberculosis depends on cooperation between the patient and healthcare provider. Patient education is essential, and many healthcare providers prefer to hospitalize the patient in order to observe him or her during treatment. The treatment consists of taking more than one medication for a duration of months. The following are some of the medications used to treat tuberculosis: isoniazid, INH, rifampin, one brand name Rifadin, ethambutol, brand name Myambutol, pyrazinamide. Some of these medications may have serious side effects, and some should not be combined with other medications or alcohol. This is why it is important to take them under your healthcare provider's supervision and follow his or her recommendations and suggestions. People who have been treated for at least 2 weeks are usually not contagious anymore. Patients who do not take their medications as often and as long as prescribed give the bacteria a chance to become resistant to the treatment. This is why it is important to follow your healthcare provider's instructions. Prevention. As with most infectious diseases, it is better to prevent the disease than to treat it. Tuberculosis is preventable. Adequate ventilation is the most important measure to prevent transmission of tuberculosis. Improving crowded living conditions to include better ventilation can decrease the risk of transmitting tuberculosis. If infected people cover their mouth and nose when coughing or sneezing, the spread of TB can also be prevented. Identifying infected people early and treating them with medications is one of the most effective ways to prevent TB from spreading. The drug INH can prevent TB and should be given to people who have latent tuberculosis. are in close contact with infected patients, have been in countries where tuberculosis is common, are at risk of getting infected with tuberculosis. Vaccines. The tuberculosis vaccine is called BCG. BCG prevents the spread of M. tuberculosis within the body but does not prevent initial infection. It is recommended for infants in parts of the world where TB is common. The vaccine BCG is not recommended for general use in the United States.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Tuberculosis is a bacterial infection that can be fatal. The body's immune system can usually fight the infection and confine it successfully. When the immune system is weak, confined tuberculosis bacteria can become active and spread to other parts of the body. This is active tuberculosis. The early symptoms of active tuberculosis include weight loss, fever, loss of appetite, night sweats. Some patients may have little or no symptoms with TB. Granulomas can also eat away at blood vessels, causing bleeding in the lungs, which could result in bloody sputum. Sputum is mucus coughed up from the lungs. Thanks to advances in medicine, treatment is available to treat active TB. It is important for the patient to follow the prescribed treatment. Tuberculosis can be prevented through good hygiene, including good ventilation and covering the mouth when coughing. A vaccine is available for some infants and is recommended for those who live in parts of the world with a high rate of tuberculosis infection.
Thank you for using Explain.